Welcome to the American Academy of Grief Counseling's videogram on low self-esteem and mental health and the importance of self-esteem in correlation with one's mental health. So self-esteem is very much equated to one's self-image. Is it a healthy self-image or a pathological self-image of self? Self-image is proportionate to reality if it's healthy. It does not overinflate the ego to a narcissistic level or devalue one's worth. It is realistic. It is founded and cemented in reality itself. It has a true understanding of who one is and where one can go, not limiting one's potential, but also not overinflating one's abilities to a dangerous level. So a healthy image is balanced, it's optimistic, it's also resilient, and it's able to accept challenges as well as failures. It is an ability to learn from failures in itself. It is important to see self-worth and uniqueness in self without seeing though oneself as superior to others or seeing oneself as unworthy of another's affection or attention. Now, mental health issues can arise when self-image is damaged. We see many self-image issues in regard to personality disorders, depression, and other issues dealing with anxiety and the inability to bond with other human beings. Now, we see a long list below of the causes of low self-esteem within individuals. And again, it comes to the point that self-image that is negative can devalue one's self and how one sees oneself within the mirror or in relationship to others. At early childhood age, a child can be exposed to overcritical parents or teachers or bullying by peer groups. So at a young age, it's very important to foster high self-esteem within a child, to praise a child so that positive self-image and healthy self-esteem grow from that. When a child is unable to progress through the psychosocial stages that reward independence and autonomy through various tasks seen through Erik Erikson's tasks of achievement throughout one's human lifespan, then the individual is pushed back. The individual is unable to find value in oneself through their various accomplishments. In addition to this, children who are not cared for properly are unable to form healthy bonds with caregivers. And this results in a variety of insecure and anxious bonds with others in their adult relationships. So a child that is not hugged or loved when the child is experiencing distress will become naturally very untrusting later in life. And due to that untrust, will also have a self-image that they are unlovable and that they cannot trust other individuals. Also, children can experience trauma, sexual or physical abuse, which can make a self-image appear of them feeling dirty, unlovable, or bad. And all of this, the self-image is not based on reality, but nonetheless, it continues throughout the person's life, making them feel inferior to other individuals, making them feel as if they're ugly or fat, or in particular, maybe a loser when they are not. And these untrue thoughts are what that haunt an individual with low self-esteem. So these untrue thoughts of being unlovable, ugly, dumb, or untalented all come from within due to, in the past, what we discussed in the previous clip regarding their childhood development. These individuals then develop very loose boundaries with other individuals. They are not able to stand up for themselves. They are not able to defend themselves. They lack confidence and trust in oneself and the ability to do what needs to be done. They downgrade compliments. If you ever come across an individual with low self-esteem and you try to compliment them, they are very hesitant to take, and they will also push those compliments away from themselves. They will reject those compliments. They will also reject accomplishments in their life and belittle what they have accomplished in life and not see these things as significant. They will also surrender easily to life challenges. And they will also become over hypercritical to others' remarks. An individual might, in passing, say something that is not toxic in intent, but it can point out to something that is very sensitive to the individual, and the individual will take it the entirely opposite way, and it will haunt them throughout the next coming weeks, to the point where they become very anxious about the comment. So low self-esteem is a dangerous road if it's not corrected. These types of untrue thoughts really wear the human soul down. Through this low self-esteem, various mental disorders can arise. Eating disorders for those who feel they are overweight, and depression can occur. It can lead to drug abuse, drinking, and social risk taking to punish oneself because they feel they are unlovable. This is where self-harm, suicidal ideation, and suicide attempts can occur for individuals who have low self-esteem. So due to the fear of rejection, this also leads to a dangerous road of lack of success because they're already visualizing failure. They're not visualizing success. They're not seeing positive energy in their life. They only see negative. And because of that, a happy life is almost completely unattainable because they do not take the chances necessary that can lead to a relationship, a successful academic or professional career in itself. Because of the dangers of low self-esteem, it's important, if one possesses this, to overcome. And usually this is through counseling, but individuals can also overcome low self-esteem in their own, just through simple things. And the first is self-affirmations. Denying what the negative, untrue self-image is stating to oneself every day, and instead repeating self-affirmations against it, saying that if you feel you're unlovable, for example, I am lovable. Also, finding hobbies, work, academics to focus your time on. Exercise in itself. Exercise has an amazing ability to raise dopamine levels, which is a reward system within one's body. It makes one feel more energetic, more good about themselves. Hygiene and self-care are also excellent ways to make one feel better about themselves. Positive energy, not just with generation within oneself generating it, but through also who you hang around and the environment one is found. Shutting out the negative when you hear negative things, and that's one of the most difficult things, obviously, for individuals with low self-esteem, is to shut out that negative talk. And this is sometimes where they need that positive energy around them to dismiss what another said, or counseling. Also, recognizing the little things and reframing them. So when you recognize little successes, you reframe them into a point where, well, how do they really relate to my self-image? Before, they might have been seen as insignificant, but if I reframe them and see them as something building towards something larger and understand where I am going in life, well, then that reframing of those little things that you do are not seen as, well, I just did this, but instead it's seen, I did do this. And it is a step to a further development in developing a more healthy self-image. Religion, faith, moral code, and belonging are also important elements to one's self-image. These give absolute codes where it's not subjective. One can go, well, I am doing this and that, and because of that, I can know that I am doing good. It's not just a thought that I'm doing good, but I am adhering to a certain code of ethics, and I should feel good about that. Journaling. Journaling is highly recommended for those with low self-esteem, because then they can relate later back to their journals and read and actually see and express on written paper what is being thought. And sometimes seeing it and expressing it are ways to allow that poison to come out of one's soul. Also, setting realistic goals and gradually seeing accomplishments. We talked about that with the little things. A lot of times individuals who have low self-esteem will try to make a dramatic change in one day, or we see these dramatic New Year's resolutions. Instead, realistic goals will prevent failure. If one has a realistic goal of losing 5 pounds instead of 100 pounds in 1 month, that goal is more attainable. And when those goals are attained, accomplishments occur. And when accomplishments occur, self-esteem begins to gradually rise. And all of this is also aided with cognitive therapies for reframing and counseling through individuals. So a lot of individuals with low self-esteem definitely need to see a licensed professional counselor. Remember, on the other side of the coin, as a person, never to put others down. You don't know what that person has gone through. And through your words, you can damage their self-esteem, and you can damage the little progress they made and send them back into their shell. So keep negative things to oneself. Remember, every human being is a masterpiece and they deserve respect. And you have no place, no matter where you are in life, to downgrade another person, because you don't know what the shoes that they have lived in and the places they have walked. So I'd like to conclude with this self-esteem video that we are the American Academy of Grief Counseling. We offer here a grief counseling certification. There's the link. Our number is 330-652-7776. And our email is info@aihcp.org. I'd like to thank you for listening and have a good day.